We're here today because a major health threat, Legionnaire's disease, has found its way to Syracuse in central New York. The good news is, while Legionnaire's disease is serious, it's also preventable. The New York outbreaks in the Bronx, Long Island, now Syracuse, provide evidence we need to do more to curb these instances before, not after, they continue to threaten public health. I am pushing a two-pronged plan that would help prevent future Legionnaire's disease cases. We need to develop a better testing standard for our cooling towers. If we don't have a standard protocol to finding out where people are at risk, how are we ever going to stem this nationwide uptick in Legionnaires? Yet amazingly, there is no national standard for the frequency of testing Legionella in cooling towers and the exact methodology of the test. While the CDC has not said cooling towers need to be inspected, it is clear that they do need to be. The CDC has indicated it's a leading respiratory pathogen, but they're not doing enough. So today I'm calling on the CDC to increase its attention on Legionnaires, to come up with protocols for inspecting the towers, both in terms of frequency, the number of times they have to inspect them per year, and the test. And then I'm calling on them to do research so that we can do much better in fighting the disease once someone gets it. The CDC continuously works to fight diseases, but with a whopping 249% increase in Legionnaire's disease nationwide, they must do more. So, I'm urging the Senate Appropriations Committee to include $500 million in the 2016 appropriation bill for the core infectious diseases program, so the CDC can develop the nationwide protocols, testing standards, and do more research. Second, once the CDC has this additional funding needed to develop better regulations, I'm pushing that the agency start working with New York State to implement them here. You see, St. Joseph's, we don't even know the test results yet, but St. Joseph's is just one of many hospitals where this may have occurred. And I do think St. Joseph's acted quickly. And we'll know, I'm not going to comment further on St. Joe's because we don't have the test results yet. Let's wait till we see them. But we do know this: St. Joseph's is fully in support of what we are doing, so they will have guidelines like everybody else should have guidelines. And I spoke to the president of St. Joe's this morning, who confirmed that with me, and they will be putting out a statement in that regard. So, that's what we have to do. St. Joe's is now taking immediate precautionary measures to prevent further patients from becoming infected, and New York State has implemented some new regulations as well, but we need federal protocols. That's the CDC is our premier research institution, and they're the ones who should be doing it. I support New York State's call to register the towers, but that will just augment what we are doing. So, bottom line, Legionnaire's disease is serious. It happened at St. Joe's, it could happen in many other places. But with strong federal protocols and research, we can stop the uptick in this disease and prevent its spread.